from home, working through Zoom, but you're spending more time on your computers. And I know I already went to the eye doctor because I got to get glasses.
Well, that's just old age, Curtis. But for those kids out there that are learning virtually, they are spending a lot more time in front of their screens too, especially with school being online now for a lot of folks out there. And I got a chance to speak with a nurse and doctor to tell us how the role of nurses is changing in schooling and how you can help your child maintain good vision health.
And for this virtual environment where students are learning, school nurses are helping parents to look at certain things that they need to pay attention to. One is prevention. So making sure that vaccines are up to date, including getting an annual flu vaccine, and making sure that they're doing the preventive care visits that they need to do, like the annual wellness checkup and also annual visits for eye care. And school nurses are making sure that families are doing that.
Absolutely. So let's talk about how the role of the school nurse has evolved kind of in this uncertain time right now, and how are they continuing to help parents provide those services to kids?
School nurses are doing more of what they've done before with the addition of some other things. So infection control measures have always been a part of what school nurses do. So making sure children are washing their hands for 20 seconds and doing that frequently during the day, making sure surfaces are clean, making sure that when the students are virtual and they go outside, they're wearing face coverings and watching their distance. But also, school nurses are helping parents to know how to create environments that are healthy for the learning that's happening in the home. And so that includes proper lighting for their work site where the students are doing their schoolwork, and also making sure those devices and the distance students are from that, their children are from those devices, are appropriate. So they're not really right up on their devices. The children's posture is straight during the time they're learning, and making sure that if there are any vision concerns that they see a health eye care health professional.
Absolutely. I just had to adjust my posture when you said that because I feel like we're all kind of in this same boat together right now. So
Indeed, we are.
here we are. This is our world now. But let's touch on that because we are all in front of our computers a lot more, and especially these kids are sitting in front of screens. So what signs and symptoms can parents possibly look for to make sure that their kids are maintaining good eye health?
So it really is up to the parents to pay attention to the behaviors of their children, because oftentimes the kid is not going to complain of blurry vision. Kids might be pulling the device up closer to their face. They may be squinting or even just closing one eye. They may complain of headaches or eye fatigue or eye strain. They can even be adopting really unusual head postures. Those will all be signs and symptoms that a vision disorder might be at play.
So how can parents really safeguard their kids from, straining their eyes or, maintaining the optimal eye health that they can for their children?
Nothing can really take the place of a comprehensive eye examination with your ophthalmologist or optometrist. But there are a couple of things that parents can try to pay attention to. So if a parent's not nearsighted, there's actually a really great website, coopervision.com, and they have a myopia or nearsightedness simulator. So it shows what the world might look like for your child if they're nearsighted. It has a little picture of a classroom and a gym, and you can toggle back and forth. On that same website is a nearsightedness assessment tool. It's a quiz, basically, 6 questions, and you can discover the likelihood that your child might actually be nearsighted. At home, a really simple thing that you can do is position your child 20 feet away from the microwave, and those digital numbers, they're about 20/20. So have your child read those numbers with each eye. If they have trouble or if they're straining to see, that could be a sign that their nearsightedness or some other vision disorder is at play, and you need to make an appointment with your eye care professional. As a mom and a pediatric ophthalmologist, in the past, I couldn't really do very much for parents who were worried about their kids' nearsightedness getting worse and worse. But now there's actually a new FDA-approved contact lens called MiSight. And what it does is it slows that myopia progression when kids start the treatment between ages 8 through 12. So there's a lot of tools now in our armamentarium of being able to combat or slow at least nearsightedness.
Absolutely valuable information, I think, for families out there, especially right now. Can you tell our viewers where they can go to learn more information?
They can head on over to coopervision.com. It's got that assessment tool I talked about, the quiz. It has the myopia simulator, and it also has a database where you can look up eye doctors in your area that are certified to fit that MySight contact lens.
You can always find this segment and more on our website at firstcoastliving.net.